you see my screen?
Yes, doctor, we can see you.
Perfect, perfect. Okay. Well, first, say thanks to Meili and Glenn to give me again the opportunity to share my experience and my result with all the audience. This is my title. I start now. First, I am KOL of Lutronic. I received conference fee. All DNA photos that you are going to see are patient treated by me. First question I ask myself, let me look at, okay. First question I ask myself, why, if I'm so happy with Spectra during 7 years, did I think about changing to Pico Plus? Well, I have 5 reasons. The first one, my main activity was and continues to be tattoo removal. I treated a lot of patients every day, no less than 10. I wanted to improve the result for light colors and residual tattoo ink. Like all these cases treated by me in my nano period. As you can see here, we have residual green and light blue and different kind of color or different kind of particle for ink, and I want to get more improved. The second reason, I live and work in Argentina. Majority of our population are skin type 3 and 4, like all these sport gods that for sure you know, and our typical fans who travel around the world, all time 3 and 4. The third reason, I have great results in skin improvement with CO2 laser, for sure, but with a lot of PIH. Like this case, as you can see here, a great result with a great reduce of all the wrinkles around the periorbital area and all the face. But you need to handle with that, with a prolonged PIH, several months, no less than 6 months. Not all the patients are agree with that. And again, not only have a grade of PIH, at the same time when I treated the patient with CO2, I have a longer post-treatment recovery time. Like this case, with a great result with a 60-year-old woman, with a reduce all these wrinkles, but with this kind of quality of post-treatment recovery time, more than a week. My fourth reason, in my experience, I still have PIH in some cases of pigmental lesion treatment and tutor removal in my nanosecond period. Like this case, as you can see here, it takes me in some cases several months, and well, I want to get improving that. That's why in my actual period, in picosecond period, I was able to treat it, tattoo removal, pigmental lesion, and when I talked about skin improvement, as my colleague, I use the Hollywood pill or Spectra pill, and I introduce you, all of you, about the LAOB, laser-induced optical breakdown. Only to remind you that there's a great difference between most of the devices, laser devices, to work in millisecond or microsecond. They cause photothermal effect instead of quick switch laser that work in nanosecond or picosecond and give us a photomechanical effect. But not all quick switches act the same way, because if you still have a nanosecond device, you have the two effects. Not only photomechanical effect, you still have photothermal effect and leave heat to the surrounding tissues. That's why in some cases you can reach side effects. If you have a picosecond laser, for sure you are close to a complete photomechanical effect. This allows us to reduce the side effects and complications. This drawing helps us to know that any kind of laser go close to the millisecond, they're going to reach a great photothermal effect and really low photomechanical effect. Opposite that, any kind of laser go to the picosecond domain or the pulse width, we can obtain a great photomechanical effect, but really low photothermal effect. In the middle, we have a lot of laser, like here, the Pico Plus, and here, the Spectra. Another reason is the same amount of joules, close to the same, 1 joule and 1 joule. If I send in a large pulse width, for example, 5 nanoseconds, I only reach a peak of power of 240 megawatts. But if I send similar joules in a less part of time, less than 1 nanosecond, I can reach a great peak of power of 1 gigawatt. And this helps us to reduce the size of the particles. I can obtain more particle disruption in more high powers. For example, if you try to see pieles to sun, this is the great compare. Particles more than 30 microns and particles less than 30 microns. And this help us, our macrophages, to eat it well. I start talking about my experience in tattoo removal. I really believe in that tattoo no longer have to last forever. We all have the right to repent and life transform us. And I really believe in these two phrases. We are able to say that a quarter of people around the world have at least one tattoo. And we are able to say too that a quarter of them are going to regret it and will look for a solution. Those are potential patients. Don't miss it. Only to mention that in 2015, ASAPS mentioned that there was an increase of 40% of the appointment in the patient looking for tattoo removal, only in the USA. And this is my experience from 2006 at 2019. I treated a total of more than 1,312 patients. In my nano period, a total of 644 patients, and my actual period, a total of 584 patients. If I give an average of 6 sessions for every patient with a rate of 1 to 12, give us that I performed more than 3,500 treatments only in my actual period. I made my own survey over 757 patients to know the characteristics of Argentinian tattoo regret. It helped me to write a future published article. A majority of my patients are women, 60% of them, most of them young, 30 years old at the average. About half of them have a great high degree of education. The most common color tattoo are black in 60% of them. The second place for multicolored. A third of the tattoo are on the upper limb, arm for arm, wrist and hand. And when I asked about the reason for removal, more than half say that dissatisfied in which how it was made or the evolutionary time because loss of definition. The second cause was job cost, and the third one, new romantic partner. The vast majority regret the tattoo really soon, 10% within the first year and more than half in the first 5 years of making the tattoo. We have difficulty depending on location of the tattoo, like skin thickness and distance to the lymph node. That's why it's really easier in face and neck and more difficult in shoulder, lower back, and extremity. And we have difficulty depending on tattoo ink characteristics, like color, depth, density, chemistry, age of quality. That's why are easier in black and white, shallow ones, low density, carbon-based ink is typical from the amateur tattoo and the older tattoo. And really more difficult in light blue and green, you need at least more than 3 wavelengths and with peak of power to be successful in these light colors. Deeper ink, high density, inorganic ink is classical from professional tattoo at the Western tattoos. But how does the picosecond laser success in this for erasing tattoo? By the photoacoustic reaction. I love this example because all of us know about the Pac-Man. In this case, our Pac-Man has a big mouth and it's impossible to eat this great and giant phantom. In which way we can help him? Well, we apply the picosecond domain laser and transform this big phantom in little ones for people to sun, to dust, and help our macrophages to eat it and take away. And he's going to take away by the lymph system to the lymph node. Why we need 4 wavelengths, or why I choose 4 wavelengths? Because if I have only 2 wavelengths, it's typical for any kind of acoustic device. I'll be successful with, for sure, to the black colors and in little part of the color of the rainbow, red and orange. But if I have 4 wavelengths, for sure, I'll be successful in all the color of the rainbow, including the black. For example, in this mosquito tattoo, as you can see here, we have black, light blue, red, orange, yellow. I need at least 3 different kinds of wavelengths to be successful. But not all the pico laser devices are the same. It takes me a complete year of my life to study and make research, looking for the best one to violet. And I choose this one because I have 4 wavelengths, a great pulse energy, is really fast, and with a great peak of power. It's not the same. Here I am during a treatment. I perform every 30 to 60 days. Professional tattoo take me an average of 8 sessions. Amateur tattoo take me an average of 4 sessions. Of course, it's painful. I need to use cold gel pad, cold air, anesthetic cream, or in some cases, anesthetic by injection, or in some cases, I need to combine it. All of this. You can choose between the 4 wavelengths, depending on the color tattoo. Always increase the energy little by little to avoid side effects. My endpoints are the wetness and the frosting. In the post-treatment, I only indicate Vaseline. My results. This is a classical treatment sequence. First, second session, the third, the fourth one. When I asked to the patient 6 months after the last sessions, and he sent me a photo, a control photo, to be sure everything okay. And this is the quality of the result. It's really easy when it's easier, sorry, when I have a traumatic tattoo by a car accident, and the way I can remove in only 1 session. Or in this case of a cosmetic tattoo, try to simulate hair, the patient regret it, and we can give him a solution. Another cosmetic tattoo in the tail or the eyebrow, in the way I can fix it in 3 sessions. This is another case of eyebrow cosmetic tattoo, but with a really difficult color, and in the way it takes me 7 sessions, but I can be successful. I love to show you that because in some cases I can offer my patients a manual card. What is that? The patient can ask me to leave a part of this tattoo, for example, these 3 stars, and remove the rest, and I can be successful too. Another case, complete removal for session. Another case, complete removal in 6 sessions. 6 sessions for a complete removal in the forearm of this patient. 6 sessions for a complete removal in the back of the neck in this other patient. 7 sessions complete removal in the forearm. The very difficult area like bikini line, 7 sessions and the complete removal, as you can see here. Really, really difficult area as is the back, and in 7 sessions, I can be successful. Take me a lot of sessions, 14 sessions. Why? Because this is a cover over other tattoo, and it's really recent with a great quantity of ink. This is the moment I finish the treatment and said only to, it's a matter of time to see is going to disappear. When I ask for a control in the way I can leave this forearm. More color, more sessions. This is a really difficult tattoo with 1, 2, 3, 4, 5 different kind of color. In the middle of the treatment, when I stop the treatment, I know that I leave this hyperpigmentation. And when I ask for a photo for control, few months after the last session, the patient will recover from the hyperpigmentation, and I leave this leukoderma over there. Another very difficult multicolor tattoo, and really recent one, and the way I am still in progress, and you can see the great result. Another difficult tattoo, 5 different kind of colors, and the way I stop the treatment. And the PIH I leave on the forearm, and it's only a matter of time or use cream with inhibitor of melanization to get improved. And here is our mosquito tattoo to see the improve after 7 sessions, and he is still in progress. When I compare my nano period and my picosecond period, I asked a few patients to return to the treatment when I found this residual pigment in the middle of the picosecond laser treatment, and after we finished, after 9 sessions. These other patients, in 2 sessions, I was able to reduce all the dark color, but all the light color is still over the skin of my patient, and after 12 sessions, I was successful. Another patient with a original black and green tattoo. Well, there's rest of the green. This is in the middle of the treatment. I caused this hyperpigmentation, turn to hyperpigmentation, and the way we can fix it and the control a few months after the last session. This patient asked me in my nano period to remove this tattoo. I tell her to wait a few months to wait the arrival of the Pico Plus, and the way in the middle of the treatment, I have this result, and when finish the treatment. My best result in some cases need a lot of time, especially to resolve transitory PIH. Like this case I show you with a great result, but in the middle we have this phantom. It takes a complete year to disappear. Or this another case again, before photo when I finish the treatment, and after a year to see this complete removal in the forearm of this patient. My parameters, I always go step by step. In 1064, I start in 1 joule and rising. In 532, I start in 0.6. In 595, I act from 2.8 to 3.6. In 660, from 2.0 to 2.8. When we talk about pigmental lesion, always remind that epidermal or shallow ones are really easy to remove. Different kind of laser can do it. We can obtain temporary or permanent elimination depending of the lesions. But when we talk about deep dermal, it's really difficult to remove. Only a few lasers can do it. Only look for Q-switch, please. We obtain a clearance. In some cases, PIH and paradoxical effect need to avoid it. And always remember that we are looking for eliminating melanosomes, non-melanocytes, as our colleagues said before. And how can I avoid PIH in deep dermal benign pigmental lesion laser treatment? By this. As Dr. Shah said us, is the concept of dendritectomy. We apply the Q-switch laser, and we are able to destroy the melanin inside the melanosome inside the dendrites, but keep intact the core of the cell. That's why we can reduce the side effects. And the other way to do it is by the concept of laser toning. Apply several times the laser over the skin, over the pigmental lesion, but with a really low quantity of joules, really low power. That's why we can obtain the subcellular selective photothermolysis without thermal damage. This is our endpoint, a mild rednesses over the chin of this patient, and the way we can fix this pigmental lesion. Another result, dark cycles in the male. After 4 sessions, only 1 session in this patient with lentigo. A melasma taking 6 sessions or more in the profile. Another melasma 4 sessions in the upper lips. These Otanebus take me 14 sessions, and the patients are really happy, not only for the improvement in the color of the skin, at the same time for the quality in the skin, because I can be successful and reduce the wrinkles around the periorbital area. Or these Otanebus in 4 sessions, I'll be successful, and I want to show you this kind of vector system to show you the quantity of brown points or brown spots I can reduce inside the dermis, as you can see here. Another difficult lesion like giant congenital nevus, in a way I can reduce the amount of color in this pigmented lesion. Another difficult lesion like birthmark, and the way with these parameters I was successful in 4 sessions. And really difficult ones and really rare, a giant nevus pilus with these parameters, and a complete year of control. Here the date, and here the date, a year of control after the treatment. We leave this area to be sure that have a control area when we finish the treatment. And this good result helped me to publish in this Journal of Plastic Surgery. You can free download from this link or ask to Lutronic for this article. Really fashionable at this day, the patient asks for genital whitening, the way I can obtain these results after 4 sessions. And these are my usual parameters. For deep dermal lesions, I use 1064 with this laser beam, with these jewels. For otal nevus and spinous nevus, for 1064, this laser beam and this amount of power. And the shallow one, 532 with this laser beam and this really low quantity of jewels. PicoPlus helped me too in my plastic surgery activity. For example, in this keloid, I was successful not only by the infiltration of corticosteroid and cyclofluoracil to reduce the size of the scar. At the same time, I applied the 1064 to reduce the pigmented lesion, and this is the way I can be successful. When I talk about skin improvement, I always have this doubt. If I choose ablative or non-ablative laser, if my patient and me agree with non-ablative laser, these are the 2 options, Hollywood peel or cold rejuvenation laser-induced optical breakdown. To remind you that ablative laser, in my experience, I obtain best results only on 1 or few sessions, but always by pain, long post-treatment recovery time, and usually associated with PIH. Instead of non-ablative laser, that on my hands, in my experience, I obtain less results, more sessions, but less or without pain, not a short post-treatment recovery time, less than 4 days, and not on really PIH. What is Hollywood peel? Well, Dr. Shah just told you that about that. I prefer to say to you that nowadays, if patients know the treatment, they ask for this treatment name. There's a greater demand for faster social occupational reintegration. They call the laser branch. And to resolve this question, what do you notice, but what the others don't notice? The patient asks for improving the skin, but without any kind of commentary for partner job or relationships, and we can do it. We need a great pigmentary expression in the photodermis, but without vascular expression, we can be successful on that. The best indication is large pores. As I mentioned that, there's a lot of information in the media, internet, and included they have the use pattern like SpectraPeel. We apply the carbon solution, wait 15 to 20 minutes. We apply the laser several times to make that explosion, not only on the surface and the inner part of the porous tube. The PicoPlus have 2 lasers instead of 1. I can choose between Pico or Nano, and for Hollywood peel I choose Nano. Why? Because I want to transfer heat, in this case, to surrounding tissue to get more improving the quality of the skin. And I want to obtain less particle disruption. Fewer particles floating in the air is equal like less optical lens damage. I need to change 4 lens during the last 2 years by this. Here I am during the treatment. As you can see here, a patient with large pores. You can see better when I apply the carbon solution and the way I can fix it. Again, to see a close view and the way I can reduce the size of the pores. Another patient, not only to measure the reduction of the pigmental lesion, at the same time, you can see the reduction of the size of the pores. Another patient, or in this case, is melasma. During the treatment, I perform the Hollywood peel 2, and I can reduce the size of the pores and get improving the quality of the skin. In some cases, I combine the 2 treatments, Hollywood peel and laser-induced optical breakdown. I start with Hollywood peel, and then change to the dual focus dot hand pins and apply the laser-induced optical breakdown. This is the patient treated by me in the front view and in a profile with a great result. But what is that? What is called rejuvenation laser-induced optical breakdown? What is this? We use focus dots to create photomechanical effect inside the dermis, in the reticular and papillary dermis, but without damaging the epidermis. We don't transfer heat to any kind of tissue. It's not mediated by chromophorus. That's why it's really safe in dark skin. We look only for the tip of the skin, not for the color of the skin. That's why we have less or directly no PIH. Usually take 3 sessions. We create a width in the laser beam. That's why we can choose between 3 millimeters of depth, 1 millimeter of depth, or directly on the surface. We create this kind of cavitation of vacuola inside the dermis. Our body, our skin knew that was hurted and tried to fill it up with generate new collagen cells. And this way we can make more thicker the skin and more healthy. Here I am choosing between step 3 is in the surface, step 2, 1 millimeter, or step 1, 3 millimeter of depth. And this is my classical parameters on the screen. Here I am treating the patient with acne sequel in a temporal area, only to show you the way I leave only wetness over the skin, as you can see here. This is a classical post-treatment. After the first day, you have a red wetness over all the face, but after 3 or 4 days, this is the quality of the skin and the redness is disappear. This is the patient I show you during the treatment. I help you with a close view, again and again. And you can see here the amount of scar after the amount of acne scar and the result after 3 sessions. The same patient with another profile to see not only the result in temporal area, in the malar area too. This patient asked me only for a skin improvement and the way I can fix it to reduce size of the pores and make disappear these pigmental lesions. And I study a new indication of the Picoplast, for example, in this stretch mark, because it's really safe in compare with allograft laser in this quality of a type of skin form. My actual parameters for Hollywood peel 1064 with this laser beam and this amount of joules. For laser-induced optical breakdown, I usually combine the 3 steps with this laser beam and this potential. And in laser-induced optical breakdown on the stretch mark, this is my actual parameter, but I still study about that. Always post-treatment indication, I indicate moistening, sunscreen, high inhibitor of melanization like tranexamic acid, kojic acid, and hydroquinone, and that my ideal weight for Hollywood peel and laser-induced optical breakdown are 3 to 4 sessions. In conclusion, and finish my presentation, deep pigmental lesion treatment on dark skin are safer if they are treated with picosecond laser, for sure. Not paradoxical effect at all, and not or less PIH. If you don't want any recovery chance in your face skin improvement treatment, please choose Hollywood peel. If you can allow 3 or 4 days with facial erythema, my choice is laser-induced optical breakdown. And if you chose layer B, it's a good option not only for skin improvement. As I show you, you have great result in acne sequel. In my experience, application of the picosecond pulse width cuts regular tattoo removal session by 20 to 40%. In my nano period, my weight was 10 to 12 sessions. My actual weight is 6 to 8. For removal of light color, you need at least 3 or 4 wavelengths and great peak of power. It's not the same any kind of picosecond laser, believe me. More peak of power is less part of time, more particle disruption, and easier the work of macrophages to digest it, to eat it. And picosecond domain laser gives the opportunity of future indication as I try to explore it these days. Thank you so much for all your attention.
I want to ask Dr. Fabian, have you tried PFD either as the silicone patch with the PFD in it or as the liquid on its own for your tattoo removal?
No, I don't have experience like Dr. Shah. I want to ask him about his experience. I think to send an email, but if he want to share his experience now, it's better for me.
Okay, thank you.
So one of our audiences have asked, how do we go about periocular pigmentation? What are the parameters and how you go ahead with treating periocular pigmentation?
Well, sorry, I want to add that in dark skin, the laser toning is the clue, is the key to have a solution because you avoid the PIH or paradoxical effect in dark cycles. This is my experience in the type skin 3 and 4.
Okay, good all. For Dr. Fabian,
Yeah.
I'm sure with the parameters you use for your laser toning, you don't have any leukoplakia. But I'm equally sure that you may well see some patients from other practitioners who arrive with this disturbing little white spots very clearly visible against their existing melasma. Do you have any pearls to share regarding treating that kind of patient?
Well, as I put you in my parameters, I always go step by step. I'm really afraid about the complications and the side effects. That's why I started in 1064 in less than close to 0.8 joules and rising. I prefer to pass several times only to find a mild and slight erythema. This is my endpoint. I prefer to make more sessions, as you say, 8 sessions, but weekly or two times or 2 weeklies, but without any danger, any damage of the skin, and have any kind of this leukoderma or any kind of side effects.
Thank you very much. Very nice. What parameters would you suggest for treating pigmentation of the lips, and how many treatment sessions would it require?
Well, in this case, I have better experience with CO2 when I have the white spots in the upper lips. I tried with my pico in 1064, it changed to 532, but really I had better result with CO2. I don't know, Safil, what is his experience?
Thank you. Dr. Fabian.
Yeah.
When we look at amateur and professional tattoos, is there an ideal spot size? Is the spot size different between them?
Yeah, the amateur tattoo are very gentle for the treatment. It's really fast and safe to do it. I start, as I said, with 1 millimeter of cytopine and really less amount of joules. But the response of the amateur tattoo is really fast. With only 1 joules is enough to have a great clearing. And in some cases, I reach to 2 joules, but it's good enough. It's not the same for the professional tattoo. In the case of professional tattoo, I try to start with a more high fluence. In some cases, 1.2 to 1.5. Do you remember that I talked about fluence by the Pico Plus device? It's not the same that the nanosecond device, of course. And in the case of professional tattoo, in the last sessions, when I reached to the 6 to 8 session, in these cases, I changed to a spot size of 4 millimeters or 3 millimeters, and I reached the power to more than 30 to 40 joules. It's enough.
Thank you. And staying with you, Dr. Fabian, when you moved from your nano period to your pico period, did it also mean higher charges for your patients?
Of course. in the way I can pay the difference. The difference, as you said, is a lot, but I'm really happy. I'm really happy with the change because, as I said, I can find a complete removal in these cases of light colors or residual ink. I asked to my patient to return to the treatment. I'm really happy with that. I treated more than 1,500 patients. I became a laser tattoo removal specialist about that.
Fantastic.
Dr. Fabian, can I ask you a question?
Yeah.
Yeah, is there any particular indication where you start with nanosecond and then move to picosecond, or you always start with picosecond in all tattoos?
Yeah, okay. The Pico Plus have the two possibility, nano and Pico. For tattoo removal, always Pico. I never change to nano. I don't find a way to change nano. But as I say, when I'm going to look for improving the skin, the quality of the skin, nano is better because I transfer heat to surrounding tissue. That's why I can stimulate better the fibroblasts to create more collagen cells. That's why for improve the quality of skin, I choose nano. Or if I go to perform Hollywood peel, but if I prefer and the patient can allow 3 or 4 days to keep wetness in the skin, the layer B, laser-induced optical breakdown, is the future key for this solution.
Thank you.
For both of you, when you're treating melasma patients, do you pre-treat with any form of lightening approach?
Dr. Shah?
Yes. So, Dr. Fabio, please go ahead.
Okay, yes. For that skin, if I have a 4 type of skin, I prefer close to 2 weeks, 3 weeks, start with inhibitations of the melanization, like tranexamic acid, hydroquinone, kojic acid. I combine it with a special formula. I say to the patient, treat it every 2 or 3 days to allow me have a better result without this PIH, no?
Question has just come in. When we're doing laser toning after soft peel, is that not going to overdo it for the skin? In other words, double laser?
I believe it's good enough. It's not a big problem because laser toning is really safe.
Well, I mean, I always advocate starting really low, just as Dr. Fabian said. You know, I think if you start at like 0.9 for spectra, and what's your starting parameters for pico, Fabian?
For Hollywood peel?
Yeah. No, for toning, laser toning, pico toning.
Yes, I start in 1064 with 0.8 or maximum 1 joules in the first session, yes.
Okay.
Really low, really low.
All right. So I would say that if you're going to do toning after a spectra peel, then you start with the minimum setting. I wouldn't go any lower, because otherwise I don't think that you would be getting the efficacy in the subcellular selective photothermolysis. So I would go with the safe protocols that you've heard from Dr. Shah for the spectra, and for Dr. Fabian for the pico.
Do you prefer to change your parameters if you're doing the laser toning mode after doing the Hollywood peel? When we are having to treat melasma, we definitely have to counsel the patient that once we get to a desired result, what are we going to do to prevent relapse? Are we going to have to advise any maintenance sessions to be done once in a couple of months?
I always warn my patient that the pigment is going to relapse. and sometimes he needs to return, but nobody knows the time. Maybe a lot of months, maybe a year, maybe a few months. Who knows that nowadays?
Thank you.
It only remains for me to say a warm thank you, Dr. Monica, for taking over during the presentation side. And of course, my very good friends, Dr. Swapnil Shah and Dr. Fabian Perez. Thank you so much, gentlemen.